Education Series, Module 3, Nutrition, Part 2. Dr. Brecky here with Ready, Set, Smile, ready to go for the second half of our nutrition module. So, what have we learned thus far? Let's take a moment to review. Nutrition, key concepts. Nutrition and oral health have a bidirectional relationship. The mouth reveals sometimes specific nutritional deficiencies. Sugar consumption has created an epidemic of oral and nutrition-related diseases and conditions. The key is finding the balance, practicing moderation, and following nutritional guidelines to ensure a healthy and happy body and a healthy and happy smile. So why should this all matter? Specific populations have varying nutritional needs and risk factors. Nutritional decisions can also be relatively difficult. These decisions may affect oral health. There are things that you can do to help educate others about making the correct nutritional decisions to make their bodies and their mouths healthy. So nutrition and oral health, the interface. Specific populations have unique oral health-related nutritional needs to consider. Let's review these populations, and this might provide some insight on how and where we might be able to educate and intervene. So let's focus first on pregnancy. During the time of pregnancy, women have increased nutrient intake, increased frequency of meals, frequency of snacking, and they do have an increased susceptibility to gum diseases, to things like dental caries, and a much increased need for a vigilant oral hygiene routine. Secondly, let's focus on infants. Infants are bottle fed. Their caregivers are giving them their nutritional decisions. They might not have teeth yet. And just remember, they have an increased feeding frequency as time goes on, and of course, as they're growing. There's that vertical transmission that we talked about of dental caries from caregivers to child, usually at this phase. And all while this is occurring, the development of their permanent teeth is happening underneath their gums, so adequate nutritional intake is hugely, hugely important during this time. So let's talk about children. They do have increased nutrient intake during their growth periods. But just remember, there's other things that are happening, such as the phases of being a picky eater. Starting school, where there's processed school lunches, which are often under revision and getting actually much better. And then just snacks, being exposed to different kids and different lunches and possibly different nutritional choices. They also have difficulty performing their own oral hygiene tasks and habits, so it's really important for caregivers to be on top of their learning at that phase, and just an overall lack of knowledge about nutrition. Adolescents? Sometimes not much has changed from childhood. They often have poorer oral hygiene habits, yet they're being exposed to things like sports drinks and sodas, especially in their school environments, peer pressure, etc. This is when orthodontic treatments come into play, which is even more essential to maintain really, really great hygiene habits. And they also have independent decision-making at that time about things like their food choices. Lastly, puberty and growth periods. It's huge to ensure that these kiddos are obtaining adequate nutrition because this is an essential growth period for their lifespan. Adults? Well, they make their own nutritional decisions. But there's things that come into play, like the use of other substances, drugs and alcohol, which does affect one's overall nutrition. An increased risk for development of systemic health problems, which also affect nutrition. And oftentimes, caregiver tasks becoming a priority. In many instances, adults put children, or even in some cases older adults, before themselves. Lastly, there's an increased risk for tooth-related problems, or even things like diet fads, which definitely can affect nutrition. Let's focus on older adults. Older adults often take multiple medications, which can affect not only the body, nutritional absorptions of things, and the mouth, with things like xerostomia, dry mouth. Systemic health varies, as well as possibly absorption conditions with obtaining the correct nutrients, poorer abilities to chew, more difficulties with eating, difficulty performing their own hygiene tasks at home, and an increased risk for oral health problems. They often have limited mobility and limited access to dental care. Lastly, let's focus on children and adults with special needs. They often suffer from underlying medical conditions which can affect overall nutrition. They have difficulty communicating their needs in some cases, or mobility issues which prevent them from easily getting to a physician office or dental office or obtaining food on their own. They may have reduced ability to perform hygiene tasks or even eat by themselves. They depend on caregivers for many things in some cases, which can greatly affect oral and overall health. And lastly, there are coverage and access to care issues and income issues. So, children and adults with special needs are a particularly vulnerable group, which, obtaining adequate nutrition and oral health are really, really, really key. But why are nutritional decisions so hard? Well, we often know what we should eat and what we should not. But it's never that easy. Let's take a look here. Which looks better? A salmon salad with vegetables or a double cheeseburger with fries? Let's break it down a little bit closer. The salad versus the cheeseburger? What about cost? Taste? Satiety? Nutrient value? Preparation time? As you can see, the salmon sauteed vegetable meal is lower in calories. It may be a little more in cost and in meal prep time. However, the nutritional content is excellent. Whereas the double cheeseburger with fries, it's cheaper, it's quicker, but it is twice as many calories, which is a problem. Nutrient content, very poor. But we can't forget taste. Now, to each their own on deciding which one is better. However, a lot of people opt for that cheeseburger and fries. What about a drink? Tap water versus a large cola soda. Cost? The soda is obviously much more expensive, whereas in the past they were obviously much cheaper. However, there is so much sugar in a regular soda, and that is one of the sneakiest places for sugar to hide in a diet. How much? 60 grams in a large cola soda. Did you say 60 grams of sugar? Well, wait a minute. What else could I eat for this much sugar? 14 teaspoons of plain sugar. Gross. 7.5 cups of strawberries. Sounds pretty good. A half of a large watermelon. That sounds like a lot. 3 slices of coconut cream pie. 2 large Snicker bars. Or 1 large strawberry shake. That all does sound pretty good. But just remember, we must be aware about making the right decisions. And that's what leads me to this next slide. Comparing our nutrients. First, you must look at the serving size. When you're quickly glancing at these nutritional labels, it's sometimes easy to not see that there's 3 servings inside something that's only 60 calories. But just know that you must realize how much a serving is to you. Determine the calories based on the serving and multiply. Check fat content and also salt. Those are sneaky additions to the diet. And of course, try to avoid saturated and especially trans fats. Focus on foods rich in fiber and protein, which you can see a little bit lower on this diagram. High fiber is great. And right here, bing, bing, sugars. You want to make sure that sugars are low, especially in things like packaged cereals, packaged anything. Look for the lowest amount of sugars you could possibly buy. Compare and know your limits, okay? And this is a very, very important part of making healthy choices for you and your family. Be careful. Don't fall for diet fads. They do not always mean more healthful for you. All natural, organic, fat-free, gluten-free, sugar-free, low-calorie, vegan, ketogenic, paleo, low-carb. Also, be wary of false claims. Yes, it may be true that organic foods are possibly more healthful than non-organic, or that a certain gluten-free food may be more healthful than an alternative. However, a lot of times these claims are written on foods that are not necessarily healthier than regular packaged, normal, unlabeled foods. Now, keep this in mind. Choosing whole foods is really the way to go. Anything that you're buying that says any of these claims, be wary of what it is, okay? Just read your foods and know exactly what you're eating. And try to make as much as you can yourself. Nutrition recommendations which neglect oral health. Now, it's very important to be on the lookout for sneaky things which may affect not only your overall health, but also your oral health. And these might not seem the worst from first glance. So, choosing sugary gummy vitamins. Gummy vitamins are great. They get us to eat vitamins, adults and kids. But be on the lookout because there are a lot of added sugars in those gummy vitamins. Eating frequent meals or snacking often, that is nutritional advice that's universally acknowledged. However, it is not good for your teeth because it's keeping your mouth underneath that critical threshold in a state of acidity that promotes cavities. Drinking fruit juices or sports drinks, those also play a lot of damage on our dentition. Drinking bottled water instead of tap because it's cleaner or healthier. Remember, fluoride is usually a part of our tap water systems in the US, and it is recommended to get those trace amounts of systemic ingested fluoride. Falling for hidden sugar foods or no added sugars, just know they're often in there. Over-consuming synthetic sugar substitutes. That's another one. Splenda, sorry to call out Splenda, but, sucralose or aspartame, etc. A lot of those alternatives do come with their risks. So try to stick with healthier ones, maybe like a stevia, or just try to avoid it altogether. Try to drink your coffee black. Now, nutrition recommendations which promote oral health include eating a well-balanced diet, reducing snacking frequency, reading your labels thoroughly, being proactive about your food choices, and maximizing your nutritional benefit with what you eat. Limiting sugar-containing beverages and foods, limiting alcohol, visiting with your physician and your dentist, and discussing these issues and asking you those questions. Choosing water before bed, especially for babies with bottles, drinking tap water and remaining well hydrated, and brushing your teeth or chewing sugarless gum between meals, which will help you to prevent snacking. Lastly, learn more about your community. Visit countyhealthrankings.org. It's an incredible tool to look at your community and the problems that may be faced. Engage yourself, and yes, there is an app for that, and they change by the day, so these might be outdated by then. Know what you're eating to a point that it's healthy. We want you to be happy and making great nutritional decisions, and we want you to inform others that that's exactly what they can and should be doing. But, of course, not overdoing it, because we all need a little tiny slice of cake every now and then. And when you can, choose local. This is my hometown, so I have to add some of my photography in here for that. The doctor of the future will no longer treat the human frame with drugs, but will rather cure and prevent disease with nutrition. Thomas Edison. Focus on prevention of nutritional deficiencies instead of the treatment of them. Remember, you are what you eat. Thank you to our sponsors. With questions regarding this module, please contact BreckyHuddleston@gmail.com. Thank you so much for joining us. See you next time.